I'm Dr. Sheel Patel, and I'll be discussing glaucoma. Glaucoma is a progressive and irreversible disease of the optic nerve, which connects the eye to the brain. The optic nerve conducts impulses that enter the eye to specific structures in the brain to allow for vision. Damage to this vital structure can cause loss of peripheral vision and possibly blindness. Glaucoma is the #2 cause of blindness worldwide, but the #1 cause of irreversible blindness. It has a significantly increased likelihood of affecting those of African descent. Other risk factors include aging, history of diabetes, those who are very nearsighted, having elevated eye pressure, and having a family history of glaucoma. The chance of developing glaucoma increases with age, and most are over the age of 40, although in limited cases it can be congenital or affect young adults. In the United States, there are about 2.8 million people with glaucoma, and that number is estimated to rise to over 6 million by the year 2050. Even more concerning is that over 1 million people with glaucoma do not know they have it, as they have yet to be diagnosed. About 2% of all Americans over the age of 40 have glaucoma, although the rate is highest amongst African American patients, well over 3.5%. There are two main categories of glaucoma: open angle and closed angle. These differ significantly. Open angle glaucoma is the form that affects over 90% of glaucoma patients and typically results from a relative lack of outflow of the eye's aqueous fluid, resulting in elevated eye pressure. The onset and progression of this form is typically slower. Closed angle glaucoma is much less common and is a result of an anatomic obstruction when the iris clogs the outflow of the fluid from the eye. Ideally, patients who have narrow angles are diagnosed by their eye specialist and treated with a preventative opening in the iris, also called a peripheral iridectomy, to avoid a sudden attack of angle closure glaucoma. However, for those that develop angle closure, patients develop severe eye pain, vision loss, nausea, and vomiting, and often a trip to the ER. This condition requires prompt treatment with either a peripheral iridectomy or a surgical procedure to relieve the attack. They also require long-term treatment to keep the pressure stabilized. Glaucoma is often referred to as the silent thief of sight. This label is very fitting because it causes irreversible optic nerve damage to so many people well before symptoms develop. It is estimated that at least 40% of one's optic nerve tissue must be damaged before signs of visual field loss start to appear on formal testing. If one waits till they notice loss of their peripheral vision or start noticing tunnel vision, then they typically lost the vast majority of their optic nerve tissue already. Fortunately, there are very sophisticated imaging technologies available currently to microscopically measure the retinal and optic nerve fibers to help diagnose glaucoma in the earliest stages. There are also function tests of the optic nerve, such as the VEP, or visual evoked potential, which allow us to determine the speed of conduction of images from the moment they reach the retina to the time they travel to the visual cortex of the brain. Tests like the VEP measure transmission speed to the millisecond and allow us to tell when the optic nerve or visual pathway has had any slowing of function. At Cape Fear Eye Associates, we have a robust glaucoma practice as we treat thousands of patients afflicted with glaucoma. We have invested in the most cutting-edge technology to assist in the early diagnosis of this potentially blinding condition, and all of our doctors are very well versed at treating this condition. Glaucoma treatment is essential to avoid further vision loss from the time of diagnosis. The traditional and long-standing method of initial glaucoma treatment is with the use of topical eye drops to lower intraocular pressure. These medicated eye drops can be utilized to get the pressure down to the patient's target range. The use of in-office laser, more specifically the SLT, or selective laser trabeculoplasty, has gained a lot of popularity over the last 10 to 15 years due to its safety profile and effectiveness. It is often used first line before drops are started, or the laser can be utilized later in the treatment process to further help with eye pressure control. This laser can be repeated if needed in the future. There is an expanding role for procedures categorized as minimally invasive glaucoma surgery to allow surgeons to reduce eye pressure with very small incisions and less risk than traditional glaucoma surgery. We offer eye stent implantation during cataract surgery for patients with mild to moderate glaucoma, and the eye stent is placed into the area where the eye's aqueous fluid drains to allow for improved outflow and results in lower eye pressure. The eye stent is the size of a date on a penny, and it is the smallest implant of any placed in the body. Another extremely effective procedure is a newer micropulse laser called the Cyclo-6 CPC laser, which allows surgeons to treat moderate to severe forms of glaucoma without making an incision in the eye. This technology has been groundbreaking for our glaucoma patients. We can still employ traditional glaucoma surgeries such as tube shunts or trabeculectomies for our most advanced cases, where an opening is made in the eye to allow fluid to be shunted out into a reservoir just outside of the eye wall. Fortunately, we perform much less of these procedures due to the effectiveness of modern medications, lasers, and minimally invasive glaucoma surgeries. Most importantly, patients need regular eye examinations to be screened for glaucoma. Early diagnosis of this condition is imperative to reduce the risk of blindness. At Cape Fear Eye Associates, our doctors and staff are here to provide the care you need to promptly diagnose and effectively treat this very important and irreversible condition. Thank you.